Gyne from the capital. The station is now the ultimate power in the universe. Overview Radio, bringing you Overview Podcast with your boy Joey Badubi Jr. with Chief Ghost always behind the lens. Go Central. Yeah, man. As you already know, guys, like we have shifted the gears now. We are more into wellness and everything, and holistic wellness in general, man. There's financial wellness, mental wellness, physical wellness, emotional wellness, and yeah, man, there's like a whole lot of wellness and all that. And today we're talking about females' wellness, but specifically gynecology, right? Yeah, specifically gynecology and all that. Today we are having a conversation it's much of a taboo to talk about, but whatever that we're talking about, both men and women, we love that, like that's something that we haven't, like our love having common too, you get it? So we are here to talk about gynecology, women's reproductive system and everything. So we are joined by a gynecologist by profession. His name is none other than Dr. Leatile Sedabadi. Welcome to the show, my brother.
Thank you.
Yeah.
Being here.
Yeah. Are you good?
Yeah, I'm not.
Yeah. So of all the professions that you could have picked, you decided to take care of, to make a profession out of taking care of women's reproductive system and all that. Yeah. Why is it that?
Common there's really not specific. There's no kids. I wanna divine, but it just came out of while really undergraduate. Going through all these blocks, the departments. We lecturing very calm, like really a sense of calmness, a sense so I liked that, and I just thought he's a gynecologist. Then I started exploring field here and thought, or maybe this is definitely for me. It's a gyne two, so care of the pregnant woman, le care high and non-pregnant, the sexual reproductive side of things. So a blend medicine from Huara, as in the surgical side. The medical party so with that maybe this is for me, so colleagues but I just learned it from there. Such that like a gynecologist.
I know that some people would ask, okay, why would you invite maybe like a male gynecologist, into the podcast and all that? But according to my understanding, women feel more comfortable when they're assisted by male gynes compared to female gynes and all that. Is it the case with you as well?
That's what I'm getting from some of my female friends. They'd say they prefer male midwives.
Yeah.
Same with gyne. So it sounds like out there people prefer male gynecologists. Not to say what Baba Sadi Baba Sadi and good gynes Baba me out there. It's just maybe maybe they got better experiences from that and just thought maybe I think
yeah. I wanted to ask you, what do you think is the reason why? Is it a psychological thing, or I don't know, a woman listens to a male's voice more, I don't know, males have a way of making females feel safe in a way or whatsoever, even in the medical space.
Wa itse ke gore bontsi jwa ke majita le fa dio di kopakopane or sengwe le sengwe sa tsamaye sentle, they don't exhibit the frustrations tsa bona most of the time, so maybe they carry that through to le kwa spanning, you know? They're always relaxed, gona go iketlilwe hela, a bit more casual le ha ba bua le balwetsi ba bone have that relationship with them where, you know, I can put anything forward to Reona o tla nthetsa.
Yeah.
And ba bangwe basadi, their fault might be gore le nna kana nkile ka nna ka iragalwa ke sena le you know, saying gore nna ne ke sa ira jana hirile ke belega or such, and it can be very off-putting to balwetsi, so maybe that's why nako tse dingwe ba prefera banna. Mela ka ke buile le basadi bangwe ba provide very excellent care.
Earlier on off air, like off camera, I asked you if it's okay for, you know, like for us to say vagina, like I'm on a public platform, and you're like, yeah, man, like it's fine. Why do you think it's a taboo for, I don't know, like for such words, you know, but for penises, like it's just okay, right? Like you can just say penis, and then it wouldn't be a problem. But why do you think it's a taboo?
I think I like gore batho ba maitseo as a people. Re batho ba maitseo tota. It's just how I see am go bua dikarolo tsa basadi jalo.
True.
Yes, that's why we are comfortable go di bua ka sa khoa wa bona. Go bua ka sa khoa go bona le comfort e gore nya ga ke a roga. Ra kwa bua ka Setswana la o ka re wa bua le rona re tlhasetsa ba re tlhasetsa basadi yana ba itse gore ke tla bua sa khoa ke bua sa khoa ke go itlhela some midwife wa motona tla re sennan a bona gore motho ntse se tsa thawedi ba ke ntsir dikolo ga ya so re batho re maitseo re batho as a people re batho re maitseo, it just comes from that.
And also as here, like we're having this conversation for educational purposes and for wellness purposes and all that, you know. So like let's talk about, like, let's get to it now, vaginal care and everything. What does gyne or vaginal care look like from the genesis hela ya ngwana mosana hela gola hela into the teens to becoming an adult and everything?
In
each stage, if you can.
So it's really much influenced by physiology le hormone mo estrogen from the pre-pubertal phase, or I say puberty to puberty, or estrogen to the reproductive ages up until abona menopause estrogen so that really influences the changes reproductive health, also vagina, uterus, and other changes that di bona. Then mo gongwe la ke gone gore ha re bua ka vagina and its health and how it changes pre-pubertally, because the environment is really a bit somewhat neutral. The microbes tse dintsi ga e acidic because it's derived of estrogen. But ha re ja puberty na le estrogen e ntsi to develop her reproductive or feminine. So the environment there changes to a more acidic environment. Influence ya gape ke di microorganisms tse di itlhelang ka go vagina ka kwa. Every post a change gape to a pre-pubertal phase, not necessarily pre-pubertal, because estrogen ga e go wela kwa tlase but ya go wa ha se tsa le menopause. So we had a few really changes in terms of the color, the ruga, the infolding tsa teng, the discharge gongwe ka tswang ka kwana e le gore mainly ka nna physiologically mme gape mo gongwe mo go ntsintsi ya gona uterus le cervix mo e leng gore tota ke gone ko e leng gore dio ka bontsi tlebe di not ka bontsi but it did go influencer thata kgonagalo a gore a ka nna le kankere mo loba popelo because as anna of reproductive age uterus ya gola cervix ya gagwe kana molomo a popelo simolla go tlhanologa the inner lining ya uterus e tswela kontle e be ya go forma mo go bidwa go the transformation zone, so that zone is liable to change into so that's something saying it's of significance really.
Yeah, so with your in your experience well, like with your experience rather in our community, are women forthcoming when it comes to vaginal care? I mean, how often do they just go for medical checkups just in J? And also, is it ideal that they just go for medical checkups just in J, kind of like it's not that important?
It's gore the gona le dio tse dintsi tse di amang bokgoni jwa bone jwa go itekodisa bona ya ka re bua gore go nna botho thata mo le gone go tshaba go bua bone bo vagina mo le gongwe le motho o motona le healthcare worker yalo go bonwa let's say 18-19 year old ke ba bangwe o ya kwa gore o simotse go tlhakana dikobo kana o pregnant wa bona gore the stigma that comes with wa go itekodisa mo dilong tsa sexual reproductive health gore le ene a wa itse gore o tshwanetse wa go lekodisang ga a tshwana ga go lekodisang mo go botlhokwa ga ntse tla re bua ka the contraception contraception gore wa go kopa contraception e feng ga e re gore o simotse go tlhakana dikobo but e ra hela gone gore nna go tlhakana dikobo at least ga kwana le an unintended pregnancy. So we tla dio tseo di influencer really di influencer bokgoni jwa bone go gore gape ga o tsena go tleliniking kwana a gore ke tleliniki a o tla itlhela batho ba receptive ba go tsaya jang a go tlebe gona le dio tse ba batlang go di dirisa mo bogompieno itlhela gore ba bangwe ba batla go itekodisa they know mo ka gore malatsinyana batho ba rutegile there's knowledge everywhere ha ya kwana o kubiwa ke either attitude ya me ke le atile gore o itseng ka tlhakana dikobo le kana nyana kana wa go jwa ke gone gore go tile gate ga gona speculum tlakamos ha tlakamos hela yalo khantli you know what ki tiela na go nke ke radio tse dingwe o hela le yana itlhobogile, so there's a lot that is hindering gore motho a ka nna le the ideal sexual reproductive health checkup me gone o tshwantse gore re itekodise hala o sa lwale ba ka re bua contraception ra itse gore contraception ga se gore ra gore o tlhakana dikobo ha ile gore o tlhakana dikobo go na le unprotected sex go na le mo ga HIV PrEP go na le emergency contraception with government public hospitals go na le gore di pap smear jalo so ga dire gore wa lwa dire ala gore you know you're on top of things.
One of the major or like commonly known illnesses related to Gyne fibroids or fibroids. I don't know how to pronounce the word properly. Fibroids or fibroids. And Yeah, like that's one of the like the main topics that we're going to be talking about today, if not the main itself. According to global and African medical data, fibroids affect up to 80% of black women, and African women develop them earlier, and symptoms tend to be more severe. Worldwide, 26 women are diagnosed with millions. Okay, worldwide, 26 million are diagnosed, with millions more undiagnosed. In Botswana, many cases go untreated due to stigma, cost, or lack of awareness. So to you, doctor, what are fibroids or fibroids, and how are they detected?
The fibroid just rather abnormal growth ya muscular part ya uterus. Uterus ena le the layer tse 3. The
Okay.
inner lining, which is yagare, and the muscle part, the limo cover and konte.
Yeah.
So the fibroid ke kholo yone ya the middle part, ya the muscular part. So gore ke tsa or re tse gore molotsi na la tsona ke gore a bana di kae dingwe tse leng gore wa go itekodisetse kae di dintsi tota gore fibroid ka baka di kae dife could be just gore mpa ya me ya gola phetela and batho ba tle ba go harasa ba re o moimana
Yeah. Is it proportional to the body?
no wa re nya motho di mpa ya gola ile ja itse gore ke nonne but mpa ya gola. So that's just could be as simple as that. O khona gone gore be gore period e botlhoko phetelela. Period ntsi phetelela ha tsena mo solo o nne le miscarriage o nne le o khate go khona go tshola o nna le bothata le go khona go tshola jalo e be le gone se le gore se re senkisa gore mme molato ka tswaele re be re hela re bona ro ha gona di fibroid ke tseda di hano re belela ile tsone di ba ka bothata jona. So tota di simola ka gore o tle o kope thuso ha ke di bona hela o le kwa lapeng.
What are the common causes of fibroids?
There's no necessarily known cause, but the risk factor are the data or being black of African descent, women of reproductive age, babas nambana, yeah, such things. But I don't a non-common cause.
So like why are fibroids more common and more severe in black women, like you mentioned? Being black, you are in risk of having.
It's probably down to genetics. I don't know, with black people are limited because the research and data is really about first world, and first world is politics. It's blacks are minority, so we have there's very few research on that. Maybe we should reinvest in more research in more about what makes up a black man and a black woman, and get more information on more malwetseng ona ntse nyana a re sa itseng gore me gona ba kwa jang and gana o itse gore le ha tse malatseng a le ya towards melemo e leng gore targeted towards the genome and all that. Or we are very far from really having the ideal treatment for the fibroid in that respect.
So like for now, like what you can say is just genetics. Like nothing beyond that, like that you can explain.
Nothing very obvious. They are commonly found with black people, and because of choice. You put off starting a family at a certain age.
Yeah.
By the time the fibroid. Those are the type of study by the fibroid. Baba in the early 30s, late 30s, basena bana with this problem period able to for a very long time, period able get for a very long time, but antse active hela go itlhella le go a bona gore kana go itlhella a lwala phetella go bona gore no di-fibroid ke tsone di bakileng gone go mo.
Does it mean that when a woman like when a woman becomes a mother, she has escaped the risk of having fibroids?
Gongwe because they are also estrogen and progesterone dependent. Gongwe there is something protective ka pregnancy. But gape mo gongwe mo eneng gore go kopakopanya theory ke gone gore kana ha le gore ona le fibroid a bana pregnant. A ke re le ra re ke part ya muscle wa uterus. Yeah le one ya gola fibroid e gola le uterus e gola le pregnancy. So that what confuses my theory gore a mirror pregnancy protective.
But are they maybe like have you ever maybe like run up into cases whereby a mother, like someone who's a mother already develops fibroids like as she gets older? Kana once you are a mother,
like it's common because the kind of the pregnancy offers rona healthcare benefit ya go to get in touch le molwetse re ha batho ba le gore have good health seeking behavior ke pregnant women ba lwela mongwe wa sele, so they have that urge to come to hospital. So bone ha ba follow ga se gantsi ba nna le di fibroid later on, they care, but ha le gore fibroid ka nna teng later on, especially mo bathong ba leng gore ba setse ba emiste go bona setswala mo bagolong ya, then gantsi re belela cancer. It's very uncommon. Marela if ke sa bona fibroid kana kwana o le pregnant, it's unlikely gore o ka nna le fibroid ya o setse o ntse o gola ya as di wa gantsi di tsama.
I wonder, how do fibroids affect sexual health of
because le balwetse mo le bone ba ha di kaitsa bone kana matlhoko a bone priority and do tsa takanediko sexual health, we tell gore they take a very back seat. Ha tile go rare nna kana ke bona mpa e gola o ra o mora re takanediko ba re ena sale ke emise dio tse bogologolo ke bona gore ba so it's very difficult to get that out of balwetse mo ngwa ga pele rona ga pele rona ya ga re botse kana ke dipotso tse leng gore di batla re gantsi o bole proactive o di botse mo tse gone gore go affecta jang sexual health ya gago. And ya kgona go nna in a number of ways, like confidence gore ya nkana mpa ke ena monna a re a itsologetse ke go polo mo re monna re o itsologetse so mpa ke ena monna re ke itsologetse na ke itsologela yes ha ke in certain positions se go nna botlhoko
like sexual positions
ha ke mo penetration go nna botlhoko because of maybe position ya fibroid ya te o monna le no utla botlhoko ra mo le no utla botlhoko ha mo penetration ngana mo thrusting ha mo certain fibroids
a man le no khona go utla botlhoko mo like mo penetration ha mo sedi ana le fibroid
tse dingwe tse di gore in certain positions kana golo gongwe and it's just for us to be a bit more proactive ro fare batho bao that openness gore ba khone go bua ka ga se topic e motho go bua ka yone from the healthcare worker side le molwetse. So
why is it not easy to, because I'd like to assume that as a patient, when I go see a dermatologist for instance, I'm going to openly talk about my skin. And also, okay, like let's give example, men's health. When I go to men's clinic, I'm going to clearly there's a problem, and I'm going to have to be open to the doctor about my health.
Yeah,
So
but
for Gyne, why is it not easy to to have such open conversations, especially the fibroids with with patients?
we tell gore wa go bua ka tsona se itlhogile like ntse ke le ka ke tsamaya di lekile mategeniki a mangwe wa bona so anything sexual reproductive tsona se dingala go bua ka sone ya ka re buile ga re batho ba re maitseo mo gongwe e tšhala gore ke monyenyane molwetse o mogolwane or it's the other way around or go na le mongwe gape o mogolwane gone gana go tsaya lobaka go bua ka yone go tsaya different techniques go tsaya lobaka yaanong gape le gore molwetse a ya especially a public hospital ga se gore wa go ithala nna hela so mongwe o tle ba a ipankantse gore no gompieno ke ya go bua ka kgang a ba tsena mo ngakeng e nngwe gape because gongwe le atile ga a thega gongwe a sign to a different area at the time gore gore o tshwanetse gore o simolole o build a relationship eo e tla go letlelang go bua ka subject matter eo so ga go motlho gotlhe but le gone I think o tshwanetse re reassure batho gore pantsha
yeah
la tla re le gonyana o bone gore what you'd get most times you'd get a very positive and helpful response.
So from what I'm getting, culture is holding back women. It's holding them against the reproductive health. Know, even like during such issues of fibroids and all that. I mean, we know that fibroids affect a whole lot of women out there. So because of culture, they struggle to open up even to gynecologists and health practitioners as well.
So gore re batho ba bantseng yang re tletse go bua ka culturally ela gara nna jalo so it's holding us back thata in some instance na go tsene go a re berekela go nna maitseo but na go tsene go tota go nna maitseo thata go sharp so go tshwere we are having to relearn a lot about go bua ka di topic tse dingwe thata tota gore no a gore be ke tlhokile botho yala gore kana nna ga ke kgotsogale ga ke kgone go tlhakana dikobo ka gore se nne sare wa bona so we are having to relearn le balwetse ba rona le bone ba re ruta I think ba re ha feedback we encourage for them to give us feedback gore re kgone go re ithute re tse journey na rotlhe as both provider le molwetse.
I guess it must require a bit of patience from you as the doctor. I mean, I can imagine patient tla super di kae but they cannot talk about some things and all that.
Hard. Yeah. But I think from the sexual health side, you know, confidence ya gore now ke bitlela ke follow kana ke bona balwetse ba di kankere ba bantsi ano a ba sena go hetsa treatment ya no itšhela ntse ke jokingly asking them about sexual health ke bona like motho a modimo wa hala segile but now ga a kgone go re sima botshelo jwa gagwe ka gore nya ra ke a lwala what's the point ya gore ke go ala ya no ha ile gore ga we go boela to at least 95% of what you were doing before. So quality of life and sex is one of them. Then generally patience you know, I'm not dealing with myself. Yes.
Yeah.
I'm dealing with someone else who ko tsamaile di kgwetlo di sele different circumstances from a human side of things, from an upbringing side of things, and then the circumstances tse dingwe tse teng han it's very different gore you know ra go ngwana o tsamaile, what's the point ya no wa bona so the motive dia harrogana, so you really have to be patient o tlhaloganye gore motho ga senna as a human being socially and socio-economic ya ka o ba batho ba kana ba se ba mogela so o sona joro le ke oro go ga ja se ba
Is there anything that you'd like to add there, my brother?
No, I just have a question in regards to like gyne care in general.
Yeah.
Doc, at what age do you think women should start consulting a gynecologist?
I have a recommended age, but kana baba a bit well off, you know. Banale benefit ya gore
A bit well off, like financially.
Yeah. Baba ukra ha tsentse ngwana this dikolo tse di relaying with anale influence ya western media. Anale a certain relationship le batsadi ba gagwe bo bana le private gyne o le dia ga gona ya teng such things, so ma go le ene go ngwa itse go mo ha benefit ya gone gore a khone go itse go itekwedisa ngaka a khone go batla the right care, the right, and so you find gore maybe 16 18 ba khona gore ba setse ba itse gore no ja go tlhola Dr. Sedabadi with respect to my family planning contraceptive side of things ga go simolla go bua le ba simolla ba build a relationship here, which is really commendable ga gore ba have a sex, it's just that they know gore go iragalang go sekolong gore rona ya no ba bangwe ba leng gore not necessarily well off ba bona gyne hela ka setsa a gateletswe go ka setsa a buketswe the se gongwe da na mata 25 fibroid 35 years later asa khone go nna le bana yalo ya no wa no say gore go bona gyne at an early age wa itse gore o tlhoka thuso kae wa itse gore what you know you have your questions answered correctly from the offset. How dikologa so hala gore ga rena bokgoni bo rotlhe, but it's something that we really need to encourage.
Done.
Yeah, no, I just have a couple of conversation.
Back to fibroids now. There's this illness that we know of. Like the name is very difficult to pronounce. Endometriosis. I hope that I'm pronouncing it well. How does it differ from fibroids? Because from a layman's perspective, like they have similar implications.
Yeah, two are common. Endometriosis is common, but not necessarily as common as uterine fibroids, but endometriosis is a very devastating symptoms so e botlhokwa tota go itse ka yone gore one le balwetse ya ko lapeng ha kana le viewers ko lapeng ha le gore ba bila bana di ka ba khona go itekwedisa before di ka di jwelela or before go nna very difficult to get any help.
What are those symptoms?
So gongela gore ke ngana yone ne re agree fibroids ke abnormal growth ya the middle part of uterus, the middle layer of uterus. So endometriosis yone ke gore that inner layer of the uterus ebe itlhelwa kwa ntle ga uterus, and kwa ntle can be mo teng ga the inner line kana mo teng ga the abdomen agere go ntse mo re go bitsa rempa so e khona gore e tlhola ko mahatleng brain yalo so yeah
like you khona go tlhola go mahatleng or at the brain
khona go itlhela ko mahatleng e khona go itlhelwa ko le ko boko so gore go ilang ko le rena it's a weird disease. It's a very weird disease. There's no very good explanation I feel the inner lining ya uterus ko yeah di kai tsa teng gantsi re di kgaoganya into 3.
Can I ask you something before you you get to the symptoms? So is it something say long gore motho o tsholwa ka gone or can it develops go ntse go tsamaya ke rala gore ha o like the inner or like the inner lining of the uterus e khona go tlhola go bokong, so I just wonder gore how does it get there or kind of to the chest?
Yeah, so there's no good theory gore why go ntse ja.
So it hasn't been established gore motho o tsholwa ka yone kana yone
Hari is the genetics at play or not, and why do others bana le one.
Yeah.
So because the balwetse ba teng ba hella ba ga ba present from gabatle early on ba hella ba tla again in the in the 20s and later on.
Is it intentional or kana haba wendi kai kana like are they shy to come through kana they don't or like that they don't experience symptoms
because
early?
The symptom ga ntse tota e go mona ke botlhoko wa bona. So botlhoko o itlhela gore there's a go lwanjang ba botlhoko nna go wa o tloga o tsena mo setswalong kana o se tsale mo setswalong go common. Now go re hela bo ya clinicing o bore botlhoko mo tle ba go ha di painkiller ba re
paracetamol
abare paramol nyana abore bontso bo wa bona. So we tla gore motho hela tsa dingwa ga bereka tsela yo hela yo ya
like paracetamol
no period tsa go ya motshwenya such things. So go hela go tsere lobaka gore motho a hela gone a bono a simotse go bona teka. So ke ngwa hela tsone di tse di irang gore go delay go hela re rile ra motho na endometriosis kana ya.
So let's get to the symptoms now. You wanted to.
So botlhoko thata e baka really more ka go bitsa re pain syndrome. Or pain syndrome ya ina pelvis bogolo jang
pelvic pain.
Yeah, so pelvic pain e baka infertility, a lot of fertility problems. E khona go baka gape le gore mosadi a ba nna di certain ovarian cysts.
What's that?
Gore so gore ovarian wa ga go e be ena le mass kana kholo e bidwa yone endometrium. So it kind of more ovarian endometriosis. So yeah, baka those 3 common symptoms. Tse dingwe di teng tse na tse high le ko mahatleng go tlhola mo go eteletseng ko bokong di fits or seizures.
Dikoto.
Yeah, dikoto. Yes. So the other symptoms are the less common, but those 3 ke tsone tse leng gore di tsagala ka endometriosis. So ba gape no ka ha di ntse ka teng di teng gape le mo malwetseng a mangwe, so it can take a while gore re hele re gore go gore ke endometriosis.
Compared to fibroids and endometriosis, which one is rare in our community and which one is common in our community?
Definitely the fibroid di go pele. Yeah, gongwe gape le gone gore re na le from the health from the healthcare workers perspective, better diagnostics is geared towards and fibroids. Re tshwara fibroids mo tlhogo. No le balwetse gape ha morare endometriosis similar or but enjoy popelo bo kwa le gare o tshameketse. So ga ba tle go utla diotse. Yeah, so ga ba tle go utla So when I go with questions, you have a fibroids. That's right. They're more familiar with that, and they can take that.
So how does fibroids affect the quality of life of a woman? Because according to studies and research, apparently like a lot of women are suffering from depression due to fibroids and all that. Is that true?
Yeah. Good how do I level or bleeding bobo excessive mo period in. Ba na anemic you talk every time has a period in so I guess this is
Anemic, that's low blood.
yeah.
Still remember my biology though? Yeah.
So as you were like, yeah, so so I guess this is ga khone go kana ka batho ka bontsi ba tsia ba tshela ka hustleng ya ba yeah so go affect output ya ga gona go ha le mo period mo output ya wa thata se sekolo how le motho athletic go ra ga kwa khona go ira dio tse ba ngo to the point ile go tlhoka go roba dion a tshela madi a bo so
yeah
a wa zona go spend na go ntsi le mo o ya se patela o tshela madi o bo wa hela ya so how I do that
does it have an impact on the confidence towards life?
Yeah,
like fibroids, like when a woman's confidence towards life.
Yeah, that, I would think so, but thing go hela gape go ne le dio tse surrounding healthcare let's say kana ke tla ga ke bone thuso epe ka lo tswa bo ramo khana mi phalape se rowe mahalape go ithala o tsena mo ga borone bo a otle gona madi so a ithala montamo di mata ai tlhobogile hela but once ya simolla go operate ga dio tse di ala hile so there's a different perspective ka bone there's a different energy ka bone hela so o ka nna motho a riala gore ba yeah
let's talk about our involvement now as men. I mean, as a man, is it also part of my responsibility to care for my partner's vaginal care and all that? If so, why?
Dinga ba re a think rona la mathata rona ke di bua tsa rona
Rona is and Majid.
yeah thata re di bua wa bona
Towards women.
yes
okay.
re di bua motho a modimo o nkga senanne wa bona o nkga senanne ga nkge sentle kana wa bona in a very derogative manner and
as in like their partners
nya sexual
or like you mean in the society or what?
Totala mo society ba nna wena ba bua sentle ka basadi ba re hela ha ile sexual partner hela hanji gonne ha go buisana sentle yeah ha go bua ba no the things they do to please their significant other ikela ile go le dinga and then what they request from us gore monna re hading o bulegile thata after delivery o bulegile thata no ga gripe se such things or the common as well and we clear ke the very unattainable expectations ga se dio tse leng gore healthcare ka go thusa ka tsone. It sounds like something you two should really deal with. So Ronald Banela, what we say to our significant, to our partners, goes towards confidence, it goes towards how they seek health, so and then some of this alternative products they use ba bankanya ser and se wrong wa bona ha motho to wa nkgatlhapi ba ba hela tsentse a tlhapa ka melemo ka kwana change the biology of vagina and aba go sane sharp so really nankare ke kganya ya go bua hela dipuo.
Earlier on, you mentioned that some men, I don't know, like they complain derogatory about what, okay, after birth, like the vagina is like bulegile thata and all that. So like those are the actual things that you hear from patients.
That's the balwetsi ba eleng gore ba tla ba sorting some improvement in their sexual health. Gantsi tlhela e le tsone dikgang tsone tseo. That's the top the list. Gore bona gore yaanong hirile ka sena go belega ga tja rokwa sentle monna a riana a sa tlhola go le monate ya ka pele. So o hela a kopa gore bonang hokotsa ka go bosading kana gore ha o re wa motlhatlhoba there's really sharp anatomy sharp sharp.
Everything is okay.
It goes towards more than just anatomy. Sexual health ga sa anatomy hela gore socially gore ena le partner ga go ba sharp. Psychologically le ena ntse se na le tumelo ya gore go na le seng se wrong ka hana then ga se obviously se dlona te. So that's the most common problem.
After birth.
Not necessarily immediately, but
post birth hela like that.
But I like that's claro go re go mo teng gongwe wa ba abasaki. Sometimes abasaki ebe gona le ebe go bulegile phetelele and that we can help with.
A lot of unmarried couples break up post birth. Kana haba sana gonna le ngwana. Are you saying that the like the gyne can be or could be part of the reasons why? Like it could be.
That's harna statistical me re itse batho ba bantsi ba kgaogane after. So gongwe we have a part to play. Habe I think more failing go dira go include other professionals like psychology, social work, and couple counseling. Or ya ka re buile na go tse dingwe re ipata ka anatomy le sexual health ya la be gona le sengwe se le gore
something
yo go la sengwe se le gore se tsontse gore se buiwe go motho a thusiwa ka sona bona. So re tshwanetse gore se mo go irisa the other allied health professionals re ba kope thuso ba re thuse kganyone.
So like is it only the vaginal care that should be shared responsibly? Like that should be jointly shared, or even the penile care as well. Like is there a word? Penile care as well. Or vaginal care here.
No, le how le bella. Go le article one of the newspapers in Ebuaga gore banna should be forthcoming ka erectile dysfunction gore ba kgone go bona dithuso. Ba rara me gona gape le rona maybe the article should have read gore basadi ba tshwantse gore ba ne ya ka o ria ba ne more supportive gore banna ba kgone go nna forthcoming. Wa bona not necessarily gore Mr. Boo wa itse re hala ga o bua go tse go ira gale. Nya wa itse hala ga o bua the basadi ba tse go le ba yang go se ka basadi ba the society go le ba yang monno le kana ga tsoga ga se go mo motho maybe ya go so really both partners have a great deal to play mo bokgoning jwa the other partner go ya go kopa thuso mo dionding all about le HPV vaccination ya program ya gore ne lebile the female the girl child hela from the economic point, finances, it made sense. Or gear towards preventing kankere ya molomo ya popelo and but le di kankere tse dingwe tsa bo rre tsa penile cancer le tsone di bakwa ke yone HPV. So
penile cancer e bakwa ke
bo HPV, human
What's that?
papillomavirus. So virus yone e baka the same sa baka cancer.
Oh, okay. Yeah.
Or gongwe le bone, you know, they definitely could have been back a benefit from being enrolled in the same program ya basadi ya HPV. So rotle we have a part to play more healthcare ya rona as men and female sexual reproduction ake monna kana basadi.
Yeah. To me it's quite surprising that you said men. Okay, like to me, guys, I'm not overriding what you're saying and all that. Yeah, but from my space and my experience and all that, it's quite surprising that you say men actually shame women. Yeah, like when it comes to the vagina and all that. But we all know that it's common that men are penile shamed all the times. You know, bole karoni, those okay. Like those kind of words and derogatory words and everything. You get it? So I wonder what now. Yeah, like with the other gender shaming the other gender, how is it like being like with your profession? Do they really come together during gyne appointments and all that? And or what? Or like in most cases mosadi o tla le one, and also is it important gore re tle rotlhe as a couple kana yang?
It's hard. Gona go botlhokwa go tla support e botlhokwa. Support e botlhokwa. Support e botlhokwa mara from public side. The public institutions, but the public side banna batla ka ba senya leina. Batla
with women.
They are being encouraged go tla. But there are some while really you had hoped for o ka ba tile partner gone ho. Me gape you know le ne monna kana go gate kae go pheletsong ya kgwedi tle ba barare kana mosadi wa tla madimo wa nna bona. There's that part of the society okay rabo go Spanish. So yeah. So when they one or le no the bed in ya ra suntsora a provide but support e botlhokwa in ga go ikutlwela wa bona go ipoletsa ngaka hela straight gore go clear certain misconceptions. Lwena gore o hold ngaka accountable kana wa bona ka ha gore nya mosadi wa me ga buiswa sentle whether the healthcare worker go botlhokwa wa bona. The greatest example e kana companionship or companionship mo basadi ba belega. Or the role of companionship ka e tokahatsang experience ya delivery ka teng go positive go ntle tota. Yes, go bona monna le hale e gona le ga la tlhegile ka ba ro bona hela gore it's really a great effort. Wa bona ha la ha ke thewa tse ke le wa ding ka molaya da gore Mr. How wana ira jana o nkgoga ke twe ke le hale kana o kwa bona. So there's that advocate part of it. O supporta mosadi o masiala metsi wa mo okisa le nna ke tshwara sentle ke bona gore go na le motho ke hona wa bona that third party in tibile. So support is invaluable. I think that's the great example ya khona go bona support in corona.
You mentioned vaginal order earlier on. We hear much on that, as well as vaginal discharges, cycles and everything. What is normal in terms of what is normal and what is not normal in terms of vaginal discharges, orders, cycles and all that you can talk about? Starting with the normal.
Yeah.
Yeah, normal ones.
Go tlhalosa, I think that what's obviously abnormal, right?
Okay.
Go baba mo go heteletseng.
Uh-huh.
Mong kwa hela yo o changeile like out of the ordinary go e ka tswa o nkga that fishy smell o stand out hela. Mo discharge changile mmala from that clear discharge to greenish, brownish, white thata e kare madilanyana so that's really what people should be looking out for, the abnormal thata. The normal can be wa go harologana mo bathong ga ye go tshwana spare but kgang ke gone gore ke mo go obviously abnormal. Ke gone gore tsontse re senke ka ra re belela gore ga gona le infection, and most importantly sexual transmitted infections, so re senka tsone tso thata.
Okay, can certain type of hygiene practices be harmful to like to the vagina and overall like woman's reproductive system? I mean, like we've heard what the le melora mengwe like e rekisiwa mo, and other doctors le bone ba rekisa melora or no this and that.
And that's also encourage a certain practice, but
exactly.
Vagina it's not necessarily sterile. Ena le di microorganisms tse leng gore di teng ka kwana tse gore di bereka to create an ideal environment for the vagina. An acidic environment, so di thusa bomme thata to maintain that environment acidic. So practices tse dingwe tse tshwanang le bo go tlhapa ka melora a tsenya melora ka kwana a tlhapa and trying to go nna clean phetelela go change-a gore ga o bolaya bacteria ye nngwe e be go sala ye nngwe sala le yone e predominant ka kwana go change-a environment, go change-a ecosystem eo. Go hela mo gongwe motho a nna le discharge ye nngwe e tswa phetelela kana a supa dikai dingwe tsa go supa gore no there's this predominance ya microorganism over the other ka gore ye nngwe e nyaleditswe ke either di antibiotic o ne re ngaka mongwe na re o alagela se sele kana practice ya gore no the douching go tlhapa ka ko bosadi, vaginal douching. So ra re go botlhokwa, those are the most common practices or di change vaginal health.
What about the cultural and spiritual practices now, like mo go teng a gongwe, I mean prostitutes for instance, like they would say, we've had a former prostitute on the show here, and she says like these practices whereby people ba go tlhapa, just to go beat their clients and all that, and also like you okay go tlhapa ka dio tsa Setswana to reduce the elasticity. I think like you mentioned earlier on gore after birth mostly like go na le mathata one elasticity and all that. Do those cultural and spiritual practices work, and are they harmful to are they harmless or harmful to the vagina?
To be politically correct, there's always room for that. There's always room for ditumelo tsa batho.
Okay.
But rather they are potentially harmful. Well, once something you can encourage about what does that contain and what is the desired effect, the desired side effect, which is not very much common ka melemo ya rona, and then the alternative medicine part. But ba go bola ha o ka bo re dio tsa ga di a siama ba jumpa tota, so they're potentially harmful. They are currently the vaginal ecosystem, the environment at the very it's delicate.
So what's your take on vaginal steaming, yoni pearls, and or other trending products or this practices Tamalatin?
This one I had a little really dodging. I remember people go to this extreme lengths in trying to achieve certain things. Ya ga bona bo steaming ja na gore mo potentially ga ka ka shalene. And he said that I got medicine again, what 1%, the precious 1%. Whatever, you know, what off? Wow, so they're not encouraged. But there's always room hela yo and have political correctness or alternative medicine law and a room more was a jamoto. We should try and preserve that natural ecosystem you have there.
How do fibroids or hormonal imbalances show up during period?
What's which usually refer to most commonly as let's say hormonal imbalance is a very vague description of
Okay.
So that cycle, menstrual cycle, that woman is as a young woman is immature because it's a mature from a similar water period to about 21, 22. You can be similar on a mature cycle and regular ya ka isolate. We want to let my little young happy more. I don't know how to tsibogelwa bona bo polycystic ovarian syndrome and a lot really malwetse a mangwe kana re bona re a tlhoka gore re ska ra phuthela re hormonal imbalance and then motho ba sa sike the right care sa bone thuso ya the right care ga ra motho a itse gore ona le polycystic ovarian syndrome kana no bo endometriosis kona bo are uterine fibroids. We do not uterine fibroids. And when the time is right, no, you know what? The other time, your period, I mean, really heavy. But you agree fibroid. Yana got on the lemon, when you interfere, you just go to the Hasi, well, the color, Banaba, some Herayals and Jews. And when our home on 42, 43, where it's now very difficult to work on. So, who talk over it? Reads when over Harry, hormonal imbalance, or I enter the Tota. Molecular and IET. And then when the time is right, about that, the two so. I would obadile I robala about where go I can't listen none.
Yeah,
it's usually very refreshing or one animal. Now, I don't know how Chase I tell us about the no deposit, but yeah, how energy and have a very nice conversation. Come with
is it ever normal to have extremely period pains?
And it's a quantity dysmenorrhea. So period able to go that. Period able to go more than what you eat. I was tell Bocillo Joarent Casway Mabaka fibroid, hormone about endometriosis. Baba other form of endometriosis, adenomyosis, helaja. So lone what talk about it's on or motogan period pains, but the Rahore time is a school as I miss a school. Aska spanning one. Liver to have active, yeah, one or you know what way piano. Push us and then if that's the Mabakanse, then it's best abone that needs investigating and attending to.
Are there any innovations surrounding gynecology this late? I mean, how is Botswana involving in terms of gyne care and women's wellness in general?
Irra. Ra gola.
Mm.
Ra gola. We are training bo gynecologists locally. Re na le bo gyne ba bantsi. We have research delay involved mo gyning, and there's no partner tse dintsi locally and outside with respect to research and innovation.
Yeah.
What's the innovative basically recently? Yeah, I think we are engaged in a few projects. Ya ka ntse re bua ka go encourage companionship mo labor. Re leka go tlhabolola le yone service ya rona le yone mo marina. With respect to women's health, with women's health cancers, le mo go bidiwa the minimal access surgery. So re leka gone go pusha go operate batho ka this camera laparoscopically, the camera, and that's really something selling or ntse re leka go se push. So not necessarily something new or innovative, but it's definitely something that's a gain traction over well.
Tampons versus pads versus menstrual cups. What do you recommend as a doctor?
The tampons, they associate usually an infections.
Yeah.
But now,
Like that, okay.
There's no it's really up to one's choice or oh yes, already on company. I think the local company there's a reusable menstrual cup, something like that. Yeah. So I found it interesting, and would how is the reception they find them useful.
Yeah.
There's always the pair or the disposable. The offer about to what do we do? That reassurance, hygiene, maintain hygiene, sharp. Yeah. So that's I think who reassuring ka di pad di tempo. I get sure ka di menstrual cup.
What's the one thing most men don't know about vaginas but should know? Like not necessarily one, but the most things that men don't know about.
They probably know. Yeah, but it's
Everybody.
from the bantay na nyi bua ya go ke etsa re batho ba itse a lot.
Yeah.
But it may be really a bit scientific thata, but one of my friends rata go boelela the definition ya vagina from our anatomy books, so it's a tubular expansile structure, right? Yeah. So it's a very interesting definition, and from an anatomically obstetric point, it can distend and then go back and resume its prior pregnancy anatomy. Is really interesting.
So I wonder, back to you now, as a gynecologist or a vaginal specialist, how does that impact your relationships? Like, does it? I don't know. Do you? Does it have some any sort of effect or impact on your personal relationships or whatsoever?
Yeah, no.
Oh.
But I definitely I would not want to be the one. When would it come to that? But let's say a lady or
Yeah.
my cousins, my sisters, no,
Yeah.
no, most definitely. Or little girlfriends, no.
So they hardly ever pull up to you with
People do.
with concerns.
People do.
Yeah.
People. What's that? Similar conversation that they dingalo in what the family gathering. No.
Oh yeah, like cousins.
Yeah,
and
no,
maybe,
aunts, friends. No.
Yeah.
So it's not something silly what I'm keen on. It's best that way. It's
Yeah.
It's best. I'm not to say that. Yeah.
Like, what about your girlfriend or your woman or whatsoever? Are you comfortable with?
No.
You're not comfortable.
No.
Oh, doctors become uncomfortable as well to have conversations with some people. It's not only patients.
Yeah, that.
Oh, okay. Interesting.
No.
Okay.
No.
Also, as a doctor, there are some people where you definitely feel uncomfortable.
Yeah, no. It's a clear relationship.
Oh, yeah. Okay.
Go and talk to this about that.
So, let's say your woman has a problem, or maybe she's experiencing some symptoms and all that. If she pulls up to you and tell you, "Oh, yo, I have this and that," what do you say? Oh, you want? Okay. Yeah. Even when you know what's going on.
Yes.
Okay.
So it's
Yeah, man. Fibroids are taking over African women's health, and no one's talking about it. So that's basically why we decided to have this conversation with you here. Caring for our sisters, for our women, for our mothers, for our cousins and all that.
Yeah.
So I don't know why is it that no one is talking about this? No one is talking about fibroids, yet they are taking over African women's health. I mean, you are a doctor, you can tell us about it, even in our community, or are fibroids really taking over the health or what?
I think why is no one talking about it? They consume a lot of Western media, Western podcasts. So whatever we are common.
Yeah.
We are cultural one. We are when in terms of healthcare, we are healthcare.
Oh yeah.
Yeah, born. Healthcare our system. It's a born. The financial systems. So from the media and little now healthcare workers and being out there talking about. Are push local. We push content subject matter. Yeah, mama our everyday lives. That's the only way. That's the only way I would reach a level to go palape, my helwana.
Boca Chica.
Yeah, Boca Chica. That's really subject matter change. Maybe we work irona araskara bua ka dio tse di taskara wa pela ka dio tse di diragalang batho ba se ara wa pela ka dio tse di diragalang are TV shows, TV series, medical drama. I read the Grey's Anatomy about a lot of video, but yeah. So but I'm not telling I like what's our I saw re ke na le bolwetse bo mo TV and then about presenter. So
Yeah.
I think that's really one way of getting this information out there. Re bue. Na le rena gape we are there. Ga se nna hela, others are also willing to sit and talk and teach. To teach on a lot of gyne, any other disease. There are a lot of people. We are seeing again the local doctors, local medical practitioners, the body associations, they are to progress public knowledge, the professional knowledge. So it's a good thing. That's hope for ya no re simolla go bua ka dio tse di rama. Yeah.
What's the difference between a gynecologist and a sexologist?
Sexology, le gyne ka nna sexologist.
Gyne khona gona sexologist.
Yes, I additional training in sexology.
Okay.
But sexology is a practice area where you deal with the intimacy. Intimacy, yes, intimacy, sexual health.
Oh, okay.
While now, how as the change in anatomy affecting your sexual health. Like
Yeah.
Sexual anatomy, change in anatomy. Endometriosis, sexual functional, sexual helayalo, have a sex.
Yeah.
Treatments there they are affect in terms of the sexual health perspective. Yeah. Read some parts about arousal, but as knowledgeable some of the interventions that's the sexology. We can get the ball rolling, but until the right people sexologists if they're going to talk intimacy and getting the most pleasure out of that intimate act.
Can a general practitioner become a sexologist? It always has to be a gynecologist. And also, can someone who's not a doctor become a sexologist?
But they are not doctors, they might not necessarily become sexologists, maybe sexual therapists. But not necessarily gynecology. I think they are probably only GP, with general practitioners. But they have interest.
Okay.
Yeah.
Dr. Sedabadi, what is your message to women who are afraid to seek help in terms of fibroids, endometriosis, period pains, vaginal care, and all the likes?
Yeah, we are there. We are public and private. Also, one wants to seek advice or care. It might be gyne. There are also general practitioners who are very confident gyne matters. So we are there. Please seek us out. Learn. We'll make ourselves available for tools. So I remember they should feel free and check.
Well, what is your message to men who think vaginal care is in their business?
Eventually it becomes your business. Eventually it becomes your business. Yes, eventually it becomes your business. Your partner's health eventually becomes your business. So it's in the best interest partner in all respects.
Yeah. Lastly, you kept on mentioning cervical cancer earlier on. How does it come into, like obviously cervix is part of the reproductive system of a woman, right? Yeah. So how do we put cervical cancer into this conversation now? Is there I don't know, is that like what causes cervical cancer? That is
gore tsena yang mo thokong ya rona when it comes to dikankere tsa bomme ke yone gongwe le bo breast cancer di go godimo ka go tsaya batshelo jwa bomme. It's a very common thata.
Cervical cancer.
Ke yone kankere e re e bonang thata. So e bakiwa ke mogare o bidiwa human papillomavirus. The human papillomavirus e baka what's called pre-malignant kind of precancerous lesions. E baka this diphetogo rata go re yalo go ditleliniking diphetogo tsone tse
Deep sea.
e baka diphetogo tsone tse di bonwang before kankere e ka nna teng, and then eventually cancer. So HPV and this changes kana diphetogo tsone tseo, and then cancer. So se botlhoko ke gone gore setse go na le tsela hela e itsagaleng ya gore e ka preventiwa jang, and e ka alahiwa yang in its earliest form. So ha re ka tla ra itekodisa ra checka dithuso di teng, and ga di dingalo ga di bake matlhoko a mantsi, ga di tlhoke madi a mantsi compared to ha motho a tla late.
Oh yeah. So the first and most preventative measure is to go like for checkups, for regular checkups.
The pap smear tsa rona re di pap smear.
Okay. All right. La go sa re sepe hela, like as long as you're a female you should normalize going for regular checkups.
Our check so tshwanetse gore motho a itse gore cervix ya gwe e lebega jang.
Okay.
A e lebega ya ka kare e na le kankere or not. So that's what we encourage.
How about man, lastly?
Prostate kind of pains.
Prostate. Apparently, like the tests that are prostate cancer that are very uncomfortable. Is it so?
Yeah, thata.
Okay.
It's I gotta tlhatlhobo hela ya prostate cancer until ka tsaya madi, which is PSA. I think gore gantsi go nna gona le joke around gore
so ya gore go
tlhatlho nya go
like it's a myth, or it used to, but not anymore.
Ga ira ke dimela gore my colleagues just santse ba dira ga gona tlhatlhobo epe e ka replace, because it's
but some idea in both
ba tlhoka gore ba tsenye monana ka go maragong ba utlwe ba feel prostate gore e feel ya it's itse gore ga batho ga ba rate ka le rena ba sa di ba rata gore wa botse go nkgotlha but batho ga ba rata go kgotlha but it's a cheap test, it's a reliable test. Ga e lwatse, so santse ile go mona gore go botlhokwa go dira hela go gore batho ba rata go kgotlha me ga bona re tata.
To be honestly, not like that's why I haven't really gone for prostate. No, I don't check up prostate cancer, chum. Like let's do a challenge. Like let's challenge ourselves. Like this coming weekend, then we go.
In malwetse a bagolo mme gone ya ka ntse re bua re batho ba simole nako e santse ra simole nako e le teng, and familiarize themselves le gore fara mme ga di kaikeng di kaikeng ha di kai di goroga what test am I going to do makgwa itlhela ba itse really gore nya testa me ne e ntse ana la PSA ya me ne le fukana la stie go mpene ke bokana rona ja itse le time la nka mara ka re di tse ha ka ba itse go tlhele.
Dr. Sedabadi, thank you so much, my brother, for for coming through and talking to women in terms of the reproductive health and all that, you know. Ke tsa ke re le bone kwa lapeng ha ba lebeletse ba tla bona bo botlhokwa ba go ikatimetsa gone ka go ka go lona ka kwa, and also learn to be comfortable around you, and get a lot like I'm around you doctors and ba bue malwetse ela a ba nang le one and everything, so that they can receive help and all that. You know, I don't know for men, like if they think that we should bring okay, like what's the opposite of a gynecologist?
Urology.
Urology
And subspecialty, yes.
And so what?
Urology, I think, in the subspecialty, but also they deal with specifically sexual health.
Oh, okay.
So,
all right, like that there locally.
The urologist locally. The urologist locally.
Okay. Yeah, well, like, man, it's up to you guys. Yeah, if you guys need us to bring a urologist here or whatsoever, so that like we get to talk about our reproductive health, like reproductive system health and all that. Yeah, like we can always do that, doctor.
Thank you very much.
Any last words?
Always available to help.
Yeah.
Again, thank you very much for the opportunity.
Man. No sweat, my brother. Go 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 amogelo yana wena o safe kana
a ke itse le nna tota ke bile ke le mote
ipotsa dipotso yeah, man. Overview podcast. We are
This station is now the ultimate power in the universe.